So for all the talk about healthcare and the healthcare vote and the absurdity of a political party voting on a political bill that they haven't read, that hasn't been scored, all the obvious criticisms of whatever it is the Republicans are doing, completely loses sight of the following fact. The American healthcare system was created by Dwight Eisenhower as a healthcare system based on our relationship with our employers. At the time, that may have made sense. That stopped making sense between 40 and 50 years ago. The Democrats started this disaster under Barack Obama with Nancy Pelosi when they refused, excuse the motorcycle, when they refused to address the elephant in the room, which is that an employer-based private health insurance monopoly is an utterly disastrous mechanism for healthcare. There are myriad systems that have been rolled out. There are too many to list. But I do recommend some reading around a man named Atul Gawande and the incredible amount of cost reduction that can be achieved through the very small efforts that can be made on the preventative side of the healthcare chain, specifically addressing simply getting those who are already sick to take their medicine, simply getting those who are diabetic to take a walk around the block. But rather than address the obvious solutions, a disastrous, egotistic, narcissist, I won't go into, forget the adjectives. What the Republicans are about to do is preposterously bad. It's tragic insofar as it's actually going to harm some number of people because of their idiocy. The good news is we actually have incredible amounts of information that will allow us to create a world-class healthcare system that is not based on an employer, that's not based on a private health insurance monopoly, and it's certainly not based on the idiocy of these politicians. I can only hope that the Republican plan is so utterly disastrous that it creates a rapid transition to a much better plan. Because sometimes, apparently, it is only through the extreme contrast and discomfort of a terrible idea and a terrible plan that a good plan can emerge. My personal hope was that the Democrats' atrocious healthcare plan would be the catalyst for a much better plan. Apparently, I was wrong. Apparently, we need to go from a flea-ridden shack to a burned-out barn before we can go to the palace that's available to us at all times if we simply open our eyes and take best practices and apply them.